All right, folks, I think we're going to get started. Some of us have to run right to the airport from here, so thank you all for coming. I'm Herbert Lerner. I am the Deputy Division Director in the Division of Reproductive, Gastrorenal, and Urologic Devices at the FDA, and that's the reviewing division where all pre-market applications for all the scopes that you use in practice come for marketing approval. Today we've put together a diverse team of folks who will touch very briefly on some of the issues associated with the ERCP outbreak from a year or so ago, highly visible in the medical press as well as the lay press, some of which has been seen by some of the legal advertisements seen on television, and which I think, at least I know at FDA and all the other societies you'll be hearing from have been working over the last year very diligently to help come up to a solution to the problem. So I'm going to start by first giving you a very brief overview of what's been going on at the FDA for the last year or so. Should be noted that there's been a significant reduction of the number of events that we've been seeing at the FDA, although it is not zero at this time. So, of course, I have no disclosures. I work for the federal government. So these are the headlines that you've seen in the newspapers over the last many years. You know, deadly infections. FDA asked for device manufacturers about cleaning. FDA knew of the design of the flaw in the scopes, etc. Medical scope makers cited for safety lapses. And this led the FDA to come up with a comprehensive review of the issue and work with a lot of different people to see if we can realize what the issue was and how we could make it go away. I'm sure everybody in the room has seen this cutaway view of the end of the duodenoscope. Of course, the difference between the ERCP duodenoscopes and the regular scopes is that there's a side viewing port and channel which allows the cannulation of the biliary tract. So what has been going on at FDA? I only took what's been happening in the last year and a half. Obviously, things have been going on much longer than that. In February of 2015, we released our first safety communication, and we updated that in August of 2015. We have published several guidance documents over that period of time, and as I'll get into in a little bit, in October of 2015, we ordered manufacturers to conduct what we call 522 studies. Here's the face sheet of our safety communication, which was issued in February, and the highlights of that communication basically say that scopes are complex and require proper cleaning and disinfection. Meticulous adherence to manufacturer's instructions is imperative, and even after proper cleaning and disinfection, we have seen reports of persistent bacterial contamination. Recommended supplemental measures at that time included microbiological culturing, ETO sterilization, liquid chemical sterile and reprocessing systems, and repeat of high-level disinfection. Some, if not all of these things, you'll be hearing from our panel in the next hour or so. Then we put out our validation methods for labeling of the reprocessing devices in healthcare settings. This was put out in March of last year, and since that time, FDA has been working with all the device manufacturers to validate their reprocessing instructions because each device manufacturer does have some slightly different instructions, and they've each, in their own discussions with the agency, have committed to validating these as quickly as possible. In the last few months, we have worked with the Olympus Corporation to go over all of their pre-market issues related to their 180 series, and that was recently cleared by the FDA. Olympus has committed to recall all of their 180 scopes and update their elevator mechanism I don't know if any of you talked to them downstairs over the last few days, but all their reps downstairs were well aware of the problem. So the FDA continues to actively monitor the situation, and we're currently, well, again, working with all the sources, including the the MAR database and all of the literature to continue to update our thinking about what's going on, and we're collaborating with a whole bunch of societies to develop validated culturing protocol, which will be discussed in a little while. We're working with CMS and the Joint Commission to strengthen adherence to reprocessing instructions, working with industry to modify and validate their reprocessing instructions, etc. I'm sorry I'm going so fast, but I don't want to use the whole time here. Additional recommendations to the facilities would meticulously clean the elevator mechanism and the reprocessing surroundings and implement quality control programs for reprocessing of the scopes. 522 studies were ordered at the end of last year. These are post-market surveillance studies, which allows the FDA to obtain additional safety and or effectiveness data for devices after it has been approved or cleared for the market. What are they? As I said, they're just studies that we can order companies to do once a device has been on the market, if it meets any of the criteria which are listed on the screen. And the one that's important is that it's to be a life-sustaining or life-supporting device, and it can be used outside a user facility. The questions that most people ask us about 522 studies are listed there, why are these studies important in association with the recent CRE infections? We want to see a higher safety margin compared to what was already provided, given the complexity of the devices. At the end of the day, we may request changes in the labeling of the device. We may issue a new post-market surveillance order to address new issues, or we can consider administrative or regulatory actions to help protect the public health. Finally, I'd like to just say a little bit about MDR reporting. It's extremely important that all facilities report all deaths and serious injuries associated with scopes to the FDA. We recognize that our MAR database is a voluntary system, and there's a significant amount of underreporting, and the more diligent facilities are to giving us the real numbers, the real-world numbers, it'll help us out. Just a snapshot of the number of MDR reports that the agency gets in a given year. And this is on Duodenoscopes, and you could see once at the end of 2013, 2014 time period was the spike. This has been what's reported since early 2015. I don't have the numbers for the last half of last year. So what can we do in the future? We can work interactively with the sponsors to guide them through the regulatory process to get new scopes on the market. We can maintain transparency in MDR reporting and reverse event reporting. We cannot make companies change the design of their device. We cannot make them manufacture disposables. We cannot regulate what happens in the healthcare facilities, so we do not credential technicians who work on the scopes to reprocess and clean them. We don't do anything about the cleaning and reprocessing instructions, except to show that we work with the companies to put the right amount of material onto the labeling of each of the devices. So thank you for the opportunity. I'm going to turn this over to the panel now.